Hi, this is Dr. Shuruk Panani from United Medical Group. Let's talk about our topic of the day, acute bronchitis. Acute bronchitis is a topic we clinicians commonly encounter in our daily practice. When I hear a patient coughing, the first thought is the cough related to their airway. What you're seeing in the picture here is a trachea centrally, which is branching off into the bronchus, which is just a passage or a tube that's connected to the central airway, which is the trachea. As the name implies, bronchitis, which has to do with inflammation of the airway. You will see that patients will express combination of cough, with or without mucus, and an associated chest discomfort, congestion, or commonly referred to as chest cold. These symptoms are required to diagnose someone with acute bronchitis. By definition, acute implies symptoms have been present for less than 3 weeks. When you see a patient with cough, chest congestion, and the duration of symptoms have been present for less than 3 weeks, this implies that the patient is dealing with acute bronchitis. The causes of acute bronchitis can be infections like viruses, seasonal allergies, lifestyle-related choices such as tobacco abuse, marijuana use, vaping, or lung conditions like asthma, COPD, bronchiectasis. The takeaway point about bronchitis is that almost 80% of your patient population will have a viral etiology and needs to be considered at the top of the differential diagnosis. I mostly worry about asthmatics who can develop acute respiratory failure due to bronchoconstriction, or commonly known as asthma attack. Also, tobacco abuse, including vaping, can result in severe inflammation of the airway and thereafter development of mucus production, which can subsequently get infected by bacteria. Let's talk about treatments. Patients mostly need supportive care and treatment for underlying causes. Most viral bronchitis is self-limiting, and treatment of underlying cause, be it a cold virus or a flu, with fluids, OTC medications like Dayquil, NyQuil should be suffice. In smokers, I do emphasize use of mucolytic agents such as guaifenesin to clear their chest. Now in asthmatics, we need to evaluate to see if they would benefit from a short duration of steroids to prevent acute bronchitis. This is also true in smokers, given their inherent risk for inflammation, mucus, which can lead to severe airway constriction. Also, other treatments like inhalers such as albuterol, which is a short-acting beta agonist, can be helpful in keeping airways open and dilating the airways, thereby giving asthmatics and tobacco users relief from shortness of breath or wheezing. Also, I commonly get asked about antibiotics. The one antibiotic that we do prescribe, which is called azithromycin. Azithromycin is a macrolide antibiotic which is shown to be effective in tobacco users due to their inherent risk for developing bacterial infection, which can benefit from an antibiotic approach. I usually reserve antibiotics for patients who are showing symptoms of both an infection and have risk factors like tobacco abuse.